Afternoon. Today I'm joined with Kevin Brady. He's the Director of Corporate Health at NFP Canada and Advoca Health. Welcome.
Good to be here.
Hey, it's not every day I read a blog article and totally loved it, which I did when I came across yours. I thought it was really dealing with mental well-being during COVID-19. And let me first start with asking you, what prompted you to write this article?
Yeah, you know what? I do a blog that comes out every week or two just to help people with various health issues and on my own journey towards good health or better health, I'll call it. But what I noticed, especially with the COVID, is, I mean, a lot of people are working from home, they're isolated, and I sense a lot of mental angst, I'll call it. And even myself, I was experiencing, I mean, my days have been crazy busy, but busy virtually, right? Like I'm having, I think my emails of, I typically get 100 a day. I think I'm getting 200 or 300 a day. I'm having virtual meetings from like literally 8:39 in the morning through the full day. And it's like, how do you shut this off? And, what habits can we best engage, even personally, can I do that I could share that will help people with, dealing through this kind of, I'll say, crisis that we're facing right now.
It was certainly helpful for me, and I quite enjoyed it. There was three things in particular I thought in the business world I just wanted you to touch on. And
Sure.
the first one was exercise.
Yeah.
Can you explain a little bit more about that?
Yeah, I mean, exercise is part of my daily routine. I'm sure it's looking at you, I'm sure it's a part of your routine as well. So I think even more important right now than ever is to get out and exercise. And I mean, I always think, like, I exercise because I compete, but I exercise just as much for mental health as I'll say physical health. I mean, it's good to burn calories and keep your weight under check, and it's good for blood pressure and cholesterol, as we all know. But I believe, probably even more as I age, I believe that exercise is really good mentally. And just to kind of get out of the zone and get those good endorphins going and just feel really good. And I think anybody who exercises knows what I'm talking about. Like after a good workout, you just feel, if anything, relaxed. Like you just feel like you've just almost done a meditation session, right? So I think, more important than ever, exercise. I mean, I'm actually making a point, I'll call it, of doubling down. And I had another president and CEO say this to me last week. He says, I'm doubling down on my exercise component. I go, what do you mean? He says, well, typically I sneak in my workouts, I get them in early. And right now we have extra time, like I know myself, I'm not in a car for an hour or two each day, which typically I am. So there's no excuse in my mind, no reason why we can't exercise and also qualify. Exercise doesn't mean you have to hop on a trainer for 30 minutes or, an elliptical or go for a run. It could be go for a nice walk, go for a hike. And that's the other thing I'll say, Brian, is that equally important, I think, is to get outside. We're in our homes, we're in our, our workspaces, whether you're working but we're isolated, talking virtually. You know what, it's the best thing you can do is get outside, get fresh air. Obviously you have to keep the social distancing in place, but the more you can get outside, and I just believe nature anyhow is good for the soul, right? It's just, it feels good for the soul. It feels good to be close to nature. So I would say, exercise and also outdoors.
Love it.
Yeah. How about yourself? Tell me, I'll throw it back at you. What are you doing in that front? Or maybe you can just comment on, especially through COVID, are you finding it easier, more difficult?
I'm doubling down as well. So I found that I'm trying to get a lot more out and better discipline and routine around first thing in the morning. That's the first thing that happens. And then with my children, trying to get them out and about as well. So
yeah.
Family training.
Well, your point's a good one, Brian. I mean, the thing I'm trying to do is similar to what I do when I'm actually working and going to my offices. Is first thing in the morning, I'm getting up and scheduling my workout, right? So that and then later in the day, I maybe my wife and I are going for a walk or a hike or doing something different. So I'm trying to make sure that I'm disciplined to get that in, and if anything, I have the extra time now, right? Because I'm not stuck in a car somewhere.
The one extra The additional point I really liked was scheduling your day. And I know I've worked from home before, but I've even had challenges in the last 4 weeks, and I've had to go back to a new discipline of making sure I get everything done on the list. Tell me about why you put that in your blog, how to schedule your day.
Yeah, actually, it was a president of a company that I was talking to last week, and I was just asking because I'm checking in with a lot of people and just asking how things are going. And his comment to me was, I'm not shutting off. And I said, what do you mean? He says, I feel like I'm really stressed because I'm working all day and all night. And so I again said, what do you mean? He said, I'm doing emails all day, and then, I'm eating, and then at night, maybe my wife and I are watching dinner, or watching TV, but I'm still doing emails. And last thing before bed, I'm checking my phone, and, just all that kind of stuff. And I said, well, you need to schedule your day. And he said, what do you mean? And I said, schedule your day no different than your work day. Schedule your workout time, schedule your work time, schedule your breaks, schedule your fitness, schedule your lunch, schedule your dinner. So one of the things I'm trying to do is at night, is not I actually put my laptop in another room, and I put my phone in another room, because, it's not good to be on social media, 15 hours a day either. Right. So even if you think it's relaxing and you're checking Instagram or whatever, to be engaged in virtual, or on our computer, or our laptop, or a phone for 16 hours a day is not, I don't think it's healthy. So at night, I'm closing my laptop, shutting this thing down, and saying, okay, the night is my family time, right? It's the time to be with the family and not be distracted by all these other things.
Great insights. I like it. And I loved your daily mantra as well. It's so rare to see an executive and somebody very successful like you with such a cool mantra. You mind sharing with us?
Yeah, it's a little personal, but and I developed this. I'm going to say 4 or 5 years ago, and mainly I find I do this when I'm exercising, right? So, and I don't know why, but I kind of, maybe I've trained myself to think of this stuff when I'm doing my exercise. So it's just kind of a thought process I go through. The first is to be present in the moment. So let's say I'm out for a walk or a hike or a run. It's to, look around, like not be thinking of work or thinking of things. It's to look around and just appreciate nature, appreciate things around you. Look at, feel the wind in your face, look at the sun, look at the leaves, this time of year, especially in the spring. As I look out the window, things are blooming, trees are blooming. Like, there's so much beauty around us. And I think we're so rushed in our day-to-day lives that we don't take note of it. So one thing, my daughter actually, often we go for runs together, and she has this saying, and she goes, just be. So we have a kilometer where we don't talk, where we just be. And I remember asking her, what do you mean just be? And she goes, a dog. She said, like, we have our dog, unfortunately passed away. We had a dog for 17 years. She said, when Wilson goes out back and he just kind of stands there, and you can tell he's sniffing, and the breeze is flowing through his hair. He said, the dog's just being. And I go, that's a great thing, like great analogy in my mind to go just be, like, be in the moment, So, I did a blog last year on, it's not about the destination, it's about the journey. And the reason I wrote that blog is I found myself, I was hiking up a mountain, but basically I was running up it, and I wasn't appreciating what was going around. And finally, about halfway through the hike, I go, you know what? It's not about getting to the top. It's about this, right? So, be in the present, right? Would be my first point of that mantra. Yeah.
Loved
So,
it.
the second piece of it is appreciation. And I think right now, I noticed with COVID, and actually my blog this week is on silver linings that I'm seeing around the whole COVID crisis. But I noticed people are very expressing a lot of gratitude. They're thankful for their families. They're thankful for their health. They're thankful for their loved ones. And I think more important than ever, I think it's important to express, just think of what we're grateful for. And it could be whatever. It could be your family, could be where you are, could be where you live, could be because we live in Canada. Whatever comes to mind in terms of gratitude. So let me ask you, do you do anything like that, or do you have a routine around gratitude at all, right?
Yeah, absolutely. I think it starts every day. Being a father, I try with my kids to make sure that they understand that gratitude is what life is about, and being thankful. And we're fortunate we have a nice lifestyle. There's not much, so how do we help and give more and give back? And that's what the game is about.
Yeah, yeah, totally. No, it's so important. And I mean, one of the things that I do, actually, another time I do this is just before I go to bed, I think of three great things that happened to me that day. And, some days we all have bad days, we all have, things that don't go well, but every day I guarantee you can find three good things that happened that day. So that's kind of my process when I go to sleep at night as well. Is
Yeah, we ask our kids that at the dinner table. We always
Oh,
ask them
good,
what good things happened in the day and how did they make a difference in their day.
perfect,
And
awesome,
it's
good.
fun. It's fun to hear it from such a young perspective around, and it's the little things we forget about, right?
Yeah, yeah, yeah. Oh, yeah, totally. It doesn't have to be major, or a big event type of thing, right?
So with COVID-19 upon us, and you're in the health, you understand a lot about healthcare. What virtual solutions are now available to access health professionals?
Yeah, so it's interesting you asked that, because a lot of people aren't even aware. But I mean, with right now, I'll say the crisis or potential crisis of the hospitals filling up because of COVID patients. I know in Burlington, for instance, Joe Brandt's built a special structure. I think the same things happened in Oakville, to look after COVID patients. So everybody's kind of gearing up. So the number one thing I think we want to do is all of us avoid walk-in clinics or emergency rooms. I know I've been really personally even stressing to my children, we don't get hurt, don't get injured. Like, the last place we want to be right now is an emergency room. But one of the solutions that actually our company does, it's virtual health. So essentially, you can access a nurse practitioner or a doctor right over your phone, and within seconds be talking and have a FaceTime call live with a nurse, get diagnosis, and even order prescriptions. Right, so people don't realize that exists. I mean, my wife last year she thought she had pneumonia. We had just flown back from a flight, and of course, all the things that happen when you're on a plane. And 2 or 3 days later, she had congestion, and I said, "Well, you should go to the walk-in clinic." And she said, "No, no, it'll get better," as a lot of us would, right? And I said, "Well, why don't you use our app?" And she said, "Well, how do you do it?" So I quickly got her signed up, which took about 1 minute. Um, and then a nurse came on and said, "Would you like to talk now or 5 minutes from now?" So and this is for my wife's first time using the service, but she said, "Can you call at 7:15?" So at 7:15, the phone rang. And of course, I know this service because it's part of what we do. And it was the nurse, and they had a doctor's visit. It was like, "How long have you had this? Do you have a fever? Can I see your throat?" So with the camera, actually, so it was like being in the doctor's office. And
Wow.
even to the point, "Can you hold your phone up to your chest? Because I wanna hear if you have any congestion." And sure enough, she said, "Yeah, everything I see, you're definitely, looks like if you don't have pneumonia, you have pneumonia bronchitis. So I'm going to order you a prescription antibiotic and a decongestant." And she said, "What pharmacy do you go to?" So my wife said, "Well, we go to this one on Upper Middle Road or whatever, Shoppers Drug Mart." And so she said, "Okay, the prescription's been sent. It'll be ready in 30 minutes. And then we're just about ready to hang up. And this was kind of the bonus. She said, "Oh, by the way, they deliver. Would you like to have it delivered?" And I said, "What do you mean they deliver?" And she said, they deliver till 9 o'clock tonight. So she said, "Yeah, let's get it delivered." And about, half an hour later, the doorbell rang, and we had her little bag of prescriptions,
Wow.
uh, and just to show you how it works. So, and that, that's just prescriptions and diagnosis, but there are solutions out there that do everything virtually, like virtual second opinions if you're diagnosed with something, virtual contact with nurses. So it could be, I just need a doctor, till I was just diagnosed with this, and everything in between can be looked after through those virtual services.
Where would they learn more about the service?
Yeah, I mean, they can contact me directly. So K Brady at Advica, ADVICA, health.com is my email. But or they can just go online and Google advocahealth.com. And the reason for the company's name is Advica, because we're advocates for your health, right? So
Awesome. I really appreciate your time today. Thanks so much.
No problem. Thanks, Brian. It was fun. Take care and stay well.
See ya.
Thank you.